Treating morning sickness, nausea and vomiting during pregnancy. How to deal with morning sickness during pregnancy. Gerald MASSA, the health educator, is the name of the channel. Welcome for today's lesson, and today we are going to talk about how to deal with morning sickness during pregnancy. After this message, keep watching. Get plenty of rest. It is important to get a good night's sleep, but also you should remember that sleeping during the day may help too, but it's always advisable that before you go to sleep, you should get at least 1 to 2 hours when you are still sitting doing something before you go to sleep. When you take some time before going to sleep immediately, it can help with nausea because the whole process of digestion takes place, and then by the time you sleep, the food will be digested. So the first tip in managing and treating morning sickness, nausea in pregnancy, is that you should get plenty. Tip number 2, we are talking about you should eat with care. Fatty and spicy foods, including caffeine, increase the chance of triggering the release of stomach acid, especially as the pregnancy progresses and the fetus pushes against the digestive tract. So it's always advisable that you should eat bland foods. These are less aggravating. Thank you, my friend. Remember to hit the subscribe button for new videos we put out every day. We are going to keep physically and mentally active. Keeping busy can help take your mind off the feelings of nausea, and then also it is advisable that you read a book. Doing puzzles, watching television, and playing cards can help too. You could also consider taking some short walks. These can help with morning sickness. Ensure good fluid intake. When you are pregnant and you are experiencing morning sickness, it's always advisable that you take plenty of fluids, and preferably you should opt for fluids, or you should opt for water or drinks which are very cold. Very cold drinks are very important because they calm down the vomiting reflex. The vomiting center in the brain is not activated by very cold drinks. So take plenty of cold fluids. This could be water, they could be juice. Remember, we are talking about the tips of managing morning sickness, how you can manage nausea and vomiting during pregnancy. Gerard MASSA, the health educator, is the name of the channel. Remember to hit the subscribe button. We are going to our next tip of how to manage morning sickness. Ginger and peppermint teas. Ginger is really very important in managing morning sickness, nausea and vomiting. The main reason is that it aids digestion, and then also it reduces abdominal discomfort. So it is always advisable that you should take some ginger. You could actually get some little ginger, mix with some hot water, and then you could take. The water can be warm, it can be lukewarm, but just make sure that you take some ginger and peppermint teas. More specifically, you should not take plenty of it. This can help in bringing down the nausea and vomiting. Next, wear loose and comfortable clothing. When you are pregnant, it's always advisable to wear loose and comfortable clothing because it has been found that when a woman is pregnant and she puts on very tight clothes, there are high chances of increased nausea and vomiting. The main reason is that the whole process of digestion is actually restricted by the tight clothing. So you should opt for more loose and comfortable clothing. The nausea will tend to subside. We are going to our next tip on how to manage nausea and vomiting in pregnancy. Vitamins and supplements. Vitamins and supplements are very important in bringing down the nausea. The main reason is that there are lots of vitamins which are actually having effects on the nausea, and normally these can be prescribed to you by your doctor, you can actually get them over the counter at your nearby pharmacy. So if you are experiencing nausea and vomiting, you could consider taking some vitamins and supplements. For example, vitamin C, it contains ascorbic acid, which is very, very effective against nausea and vomiting. Next point, triggers of the nausea and vomiting. There are many triggers of nausea and vomiting. Once you identify, maybe there could be smells, certain types of foods, you can actually avoid them. This can really help in bringing down the nausea and vomiting. Help for acid reflux. Whenever you are getting lots of acid reflux, you should actually consult your doctor. Your doctor can prescribe you some antacids. These are really very important. They can be in form of syrups you can take, and then before actually going to bed, the nausea and vomiting can subside. The best diet recommended for all patients, for all pregnant mothers who are having nausea and vomiting, is as follows. Cold foods are really very important in people or in pregnant mothers who are experiencing nausea and vomiting. And then also plain fruits and vegetables are also very important. The main reason is that they contain lots of vitamin C, which is very effective against nausea and vomiting. Bland foods such as chicken soup are also very effective in all mothers who are having nausea and vomiting. So if you are experiencing nausea and vomiting, consider having some chicken soup. It is very, very important, very effective in bringing down the nausea and vomiting. Thank you, my friend, for watching today's lesson. We've talked about the ways you can manage nausea and vomiting, how to manage nausea and vomiting in pregnancy, and we've talked about some of the tips you should follow to manage nausea and vomiting. And in summary, we've talked about getting plenty of rest. Next, eat with care. Avoid highly spiced foods and fatty foods. Keep physically and mentally active, and then also ensure good fluid intake. Next, we talked about ginger and peppermint, and then also wear loose and comfortable clothes. Have a fantastic day and God bless. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerald MASSA, the health educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye.